right, so when we talk about lung cancer awareness, a lot of times people think, I don't smoke cigarettes, so does it have anything to do with me? Can you answer that question for us?
Yes, so the Mississippi Department of Health state that lung cancer is the #1 killer among men and women in the U.S., and cigarette smoking is the leading cause. There are other risk factors along with that. History of lung cancer can be affected, diabetes, heart disease. Some of those can play factors, but not smoking decreases your chances tremendously. That is the #1 cause. So.
Gotcha. So when you talk about, okay, when should I go get screened? What age range should I start looking at? Because, you know, people talk about mammograms. You should be about this age. What is that for this particular thing?
So screening is real important. If you're between the ages of 55 to 70, you should be screened. If you have a significant history of smoking, as well as if you have quit smoking less than 15 years. There are also cases where if you've suddenly, like cold turkey, quit smoking, lost weight, have coughing, shortness of breath, wheezing. However, sometimes those symptoms do not arise until the cancer is actually too far spread. So.
Gotcha. Okay. And so we're looking at things right now. So obviously there's radiation opportunities available and other things like that. Can you tell us more about where you work and what those services are?
Yeah, so I work at Merit Health Central, and we have a cancer center who offers preventative services, screening services. We do radiation therapy, chemotherapy. We have a great team of doctors, nurses, radiation therapists who basically take the patient in and treat them from the screening process to the diagnosis, through the treatment to their recovery. Cancer diagnosis is scary emotionally and physically as well, and so we have a great team that helps provide care and compassion and safety and make patients feel, you know, that they're on the mend.
Okay. All right. So if we had to do like 3 fast facts about lung cancer awareness, #1 would be what? What age should I go ahead and start?
55 to 70.
Okay.
CT scans, that's a good screening tool. There are CTs that we'll do that help us see if you have a mass, a tumor, and then as well as just the main thing is quit smoking. Don't smoke. That's the main point to preventing lung cancer.
Gotcha. So if you're watching right now, you just want to ball up them cigarettes and throw them away. That's what you said.
Exactly. Ball them up and throw them away.